This is the patient's liver core biopsy. On the left section we can see the normal hepatocytes. On the right section we can clearly see the tumor, and this tumor is poorly differentiated tumor, which is displaying a marked polymorphism with giant cells, which doesn't resemble the normal hepatocytes. And there is, as you can see, gland formation has been seen at the edge of the tumor, which is characteristics of adenocarcinoma. And also we can see the bile ducts, which are proliferating around here, and this is the fibrotic, which is a maturing fibrotic stroma of the cancer cell. And for us to know the primary unknown sites, we have to conduct immunohistochemistry to diagnose the metastatic carcinoma. Here we have the appendix, which is a control slide. We applied keratin 20 marker. We can see it has positively stained the luminal epithelial cells. And keratin 20 marks the gastrointestinal, Merkel cells, and the ureterial carcinoma. And we're going to apply the keratin 20 marker on the liver biopsy as well. As you can see on the liver core biopsy, when we apply the keratin 20, it has stained the cancer cells here, which are heavily stained, and here as well. These are the loosely stained bile ducts here. And from here we can suggest the keratin 20 was positive for the cancer as well. It was positive for with the bile ducts as well. The second positive control is the tonsil. From here we can see it has positively stained the epithelial crypt here. This is a squamous epithelium. And the keratin 7, it marks for bile ducts and blood vessels as well. And we're going to apply this on the liver core biopsy. In the liver core biopsy, when we apply the keratin 7 marker, it hasn't stained the cancer, but it has stained the bile ducts. These are positively stained proliferating bile ducts. From this, we can deduct that the keratin 20 was positive, which has stained the liver cancer, and also the keratin 7 is negative because it hasn't stained the cancer. So there are two cancers that give results. These are the colorectal cancer and the Merkel cell carcinoma. Based on this, the patient's clinical history is going to be colorectal cancer, and since the bile ducts has been stained, the C7 and C20 are positive, suggesting a gland formation of coloangial carcinoma.